Our kidneys filter all the blood in our bodies every 30 minutes, and so obviously functioning kidneys is vital to good health. Heather Powell is with the Nashville Kidney Foundation. Thank you for coming in.
Thanks for having me.
To discuss this. It's Kidney Month, National Kidney Month, and we know that kidney disease is extremely prevalent. Why is that the case?
Well, in Tennessee in particular, it's prevalent for a number of reasons. Two of those are that the leading causes for kidney disease are hypertension and diabetes, and the rates of those two diseases are particularly high in Tennessee. Overall, the health of Tennesseans is not as good as maybe we hope it would be, so we do see a higher risk and rate of kidney disease here.
And what is the cause of that? What has led to that problem in our state?
Just general health. Access to health care is an issue in Tennessee. People just being able to visit their primary care physician and get that ongoing care that they need to maintain their overall wellness and health. But hypertension is a big problem, and addressing things like hypertension and diabetes early can really do a lot to help prevent kidney disease down the road.
Give us a little primer, if you would, on the function of our kidneys and the filtering process and what exactly the kidneys do.
The kidneys are really awesome organs, and they're organs that people just don't talk about a lot,
No.
but they're very important. They actually filter the blood in our body, and so like you said, they filter many quarts very frequently throughout the day, really all the time they're filtering blood. So they take all the things out of your blood that you don't need to make your body work, essentially. So when kidneys start to slow down or the function gets diminished, things start to build up in your body that shouldn't be there, toxins and waste and things like that should not be a part of your body, and that's when health starts to decline. So kidneys everybody has two, or most people have two. You can actually live with just one, which is really a unique feature of kidneys, which is why living kidney donation is such an awesome ability that lots of people have and affects the lives of lots of people who have kidney failure, but kidneys are constantly working.
Yeah, that 30-minute, I didn't realize how often the filtration process was happening in the body. So warning signs if there is a kidney problem. Obviously, if you get regular physicals and you look at the different numbers, your lab work, doctors can see if there's a problem, but what are some of the warning signs?
Well, one of the problems with kidney disease is it's called the silent disease, and that's because there are often no symptoms until people are so far down the path with kidney disease that there's no turning back. So there are stages of kidney disease like there are with lots of other diseases, stages 1 through 5, and about 90% of people with stage 1 through 3 don't know that they have kidney disease because they haven't seen any symptoms yet. When they do start to present, you'll see things like swelling, chest pain, changes in urination, things like that. But really the only way to test for kidney health is to have specific tests with your doctor, or with organizations like Tennessee Kidney Foundation. We provide free kidney health screenings for the community.
I'm looking at the warning signs up on the screen. If we could go back to that for a second, there was quite an extensive list. It says even back pain, itching, that can be one of the signs. Loss of appetite. I mean, that's sort of a vague thing.
It is, and a lot of those symptoms can be vague, and they can be attributed to other things, and not things that make you think about your kidneys right off the bat. So it's always important to, if you have risk factors for kidney disease, like hypertension, like diabetes, or family history of kidney disease, things like that, to keep an eye on kidney health with either your doctor or seek Tennessee Kidney Foundation out and have a free kidney health screening.
What are some of the treatments for kidney disease?
So if you catch it early on, there's a really good possibility that you can hold kidney disease where it is and keep it from progressing.
Keep it stable.
Right. So you can do that through managing your diet. There's something called a kidney-friendly diet that you can follow, really to work with a dietitian to look at nutrients and proteins and some things. It's a very specific group of foods that you should eat and should avoid if you have kidney disease to kind of maintain kidney health. Outside of that, monitoring blood pressure. If you have high blood pressure, take the medication. Don't skip a dosage, because high blood pressure it both contributes to kidney disease, and kidney disease can also cause high blood pressure. So you kind of get it from all sides with hypertension and heart disease. If you have diabetes, manage your glucose and your blood sugar. Just some of those maintenance type of things can really help to prevent kidney disease from progressing. But once you do go to stage 4 and 5 kidney disease, that's kind of the point where you can't walk it back, and the options from there are really dialysis and transplant.
let's go back to something you said a minute ago about foods to eat and not to eat. So let's talk about what are the good foods for kidneys.
Well, it's really particular to the person. So one of the resources that Tennessee Kidney Foundation has, we have a renal diet handout. So you've probably heard of things like Eat This, Not That, and those types of food programs. Well, we do something like that in this dietary handout that we have. It was developed by dietitians and with the supervision of physicians. We've got categories of foods: foods to eat, foods to enjoy, foods to avoid. And it's something that we recommend people hang it on your refrigerator, keep it somewhere close by so that when you go to the grocery store, if you're going out to eat, you can refer to that list.
Make it user friendly. I think you kind of answered this previously, but I'm going to ask it again anyway. Can you do anything to prevent it, kidney disease? I think it's probably common sense, but
it is very preventable. So just general health is the most important thing. If you can avoid hypertension, if you can do things that, avoid things that cause heart disease or high blood pressure, you can also help avoid kidney disease. And the same thing with diabetes. But once you have those conditions, if you can try to keep them under control with medication, that can really help prevent the onset of kidney disease.
It says even, get tested if you're at risk. What would make you at risk? I think you alluded to that earlier as well.
Lots of risk factors outside of hypertension and diabetes. Age is a risk factor, so people who are over age 60 are higher risk for kidney disease. African Americans are 3.5 times more likely to develop kidney disease than any other group of people. Hispanics and Native Americans are also at higher risk for kidney disease. How can we get more information for people watching? TennesseeKidneyFoundation.org is a great resource. You can call us. People call us every day to ask, I have a family member who's at risk, or I've been recently diagnosed with kidney failure. What can I do next? And we've got lots and lots of educational resources we can provide.
All right, Heather, we really appreciate you coming in and sharing your knowledge at a time when we really focus on good kidney health.
Thanks for having me.
Thank you. Thanks so much for coming in. And thank you for watching Community Health Matters. You can learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.